Thank you for listening to Depictions Media Radio. Welcome to Policy and Rights, the show about human rights and government policy. Okay, and welcome back, everyone. We're here back again in this time of pandemic, and we're going to cap off some of the statements that were made over the past week by various political figures and health figures. So let's get started first off with Bonnie Henry, and she's talking about measures that she has taken in British Columbia to help us get through this increasing number of cases that have come, and the attempt to really save lives and help the most vulnerable as we go through this Christmas season. And it's going to be what we would consider to be a very strange Christmas season because of the limitations to be able to gather, the limitations of us to be able to smile and hug each other during this time, because when we do those things, we could actually be putting all of those around us in danger. So let's listen to what Bonnie Henry actually has to say. Hold on.
Good afternoon. My name is Adrian Dix. I'm BC's Minister of Health. To my right is Dr. Bonnie Henry, BC's Provincial Health Officer. This is our COVID-19 briefing for British Columbia for Thursday, December the 3rd. We're honored to be here on the territories of the Lekwungen-speaking people, the Songhees, and the Esquimalt First Nations. Tomorrow, Friday, there will be a written briefing from Dr. Henry and myself, which you should be receiving around 3 o'clock. On Monday, December the 7th, there will be an in-person briefing here in Victoria in the Press Theatre starting at 3 o'clock. And with that, it's my honor to introduce Dr. Bonnie Henry.
Thank you very much, and good afternoon. Today, on December 3rd, we have an additional 694 people who are positive or have been diagnosed with COVID-19 here in British Columbia, including 4 who are epidemiologically linked cases, bringing the number of people with COVID-19 in BC to 35,422 people. Of the new cases, 114 people are in the Vancouver Coastal Health Region, 465 people are in the Fraser Health Region, 10 people are on Vancouver Island Health, 82 people are in Interior Health Region, and 23 people are in the Northern Health Region. We are now up to 9,103 active cases across the province in all health authorities, of whom 325 are in hospital currently, 80 of whom are in critical care or ICU. We have 10,849 people under active public health monitoring and 24,928 people who are recovered from COVID-19. Again, today we have 12 new deaths to report, to bring our total number of people who have died from COVID-19 to 481 in the province. And my heartfelt condolences go out again to the families, our care providers, and the communities who lost loved ones, and we mourn with you. We have 3 new healthcare outbreaks to report in British Columbia, one at the Bailey House long-term care home, one at Gateway Lodge, and the University Hospital of Northern BC, both of which are in the Northern Health Authority. We now have 56 active outbreaks in long-term care and assisted living, and 8 in acute care. And that involves 958 residents and 559 staff. across the province. We are continuing to make progress, as we talked about earlier this week, on our BC COVID-19 immunization vaccine strategy, Operation Immunize, and we have established now our emergency response, or emergency operations coordinating committee to lead the management and very soon, we hope, delivery of vaccines across our province. And today, Dr. Ross Brown, who has been leading the charge on this, along with a number of our key folk from the BC CDC team and others, participated with our provincial and federal counterparts on a remote tabletop exercise to try and walk through all of those key steps that we're going to need to have in place and understand how to facilitate the vaccine delivery and then immunization processes here in the province, and to anticipate any of the challenges or roadblocks that might come up, so we can address them now, as we know that vaccine will be available in the coming weeks. And next week, Dr. Brown and myself and Minister Dix will provide a detailed update to everybody on our plans and where we are and how we are going to move forward here in British Columbia to make sure that people can receive immunization in the most efficient and effective way possible as soon as it is available here in Canada. As you know, our focus with this pandemic has been to understand risks and to take the measures we need to address those risks. And the risks are about where and how and with whom transmission is occurring. And that is what we have been doing, and we've been learning from the very beginning. We look at what is happening here in BC, as well as we look at what happens across Canada, across the US, and around the world, and we learn from what is happening and the measures that people are taking everywhere. And based on this information, we put in the measures that we feel are needed here in British Columbia to best protect everyone in the province. As vaccines become available, they will become our first step to protect people who are most at risk from severe illness and from death, and to protect our healthcare system. We know that we will have limited amounts at first, so we won't be able to broadly achieve what we've been calling community immunity or herd immunity right off the bat, but that will come. Our first priority will be to make sure that we're protecting those who are most at risk. We know that is our seniors and elders in our communities, in long-term care homes in particular, and in hospitals here in British Columbia. And once we have more vaccine available, we will be making it available to all of us in BC. And that is when we can get to that point of managing and controlling this pandemic. But for now, we must all stay strong. Many of our communities around this province are affected right now, many of whom went through the first wave, the first number of months of this pandemic without having cases, without having it touch close to home. And we know that our long-term care homes in particular are most vulnerable, and we know right now it's the biggest challenge that we are facing. And the healthcare workers who are working tirelessly in our hospitals, but in our care homes across the province, are doing their very best to care for people on a daily basis and to try and keep this virus at bay. But we know our hospitals, our long-term care homes, and our healthcare workers are strained and are tired. And we need to do our bit everywhere to make sure that we support and protect them too. And that is the purpose of the orders that we've had in place here in BC, the reason why we need to reduce our social interactions, the reason why we have postponed or suspended or cancelled events, the reason why we put in restrictions on some of the adult team sports that we have had and been able to enjoy in the last little while. What we have seen is that when people come together, this virus can spread, now more than ever, particularly as we go through winter in the province. I do want to say, though, that I recognize that this sacrifice is one that all of us are taking, and the vast majority of people around BC have taken this to heart and are doing their part to protect us all, to protect those we are closest to and those we don't know. And you may feel that you are the only one. It seems like there's lots out there, people who are not taking this seriously. But I know better. I know that we have seen sacrifices from people everywhere in BC, and that you are all part of our team, and that is what is making the difference for us. We need to stay all in, 100% committed to getting us through these next few weeks to months, so that we will have the ability to protect people and to save lives. And through your efforts, we will get through this. We will get through this pandemic together. And we will do it by being kind and being calm and being safe. Thank you.
Okay, so we know that there have been limitations on social gatherings, that at this time we're not going to be able to visit with each other in each other's homes, but maybe we can find other ways to celebrate with each other, using technology and communications that we actually have. So find a different way to celebrate and have that big family party. Okay, so next up we have Justin Trudeau, Prime Minister of Canada, and he's going to tell us a little bit about some of the measures that the federal government is taking, and along with that is a proposed, some of the proposed plan for distribution of the vaccine that will be coming from Pfizer, and he is going to discuss the status of that for here in Canada. Also, the job market, he's going to talk a little bit about that, and make some other statements about how the federal government is going to help boost the economy and help us move through this time of pandemic. So let's listen to what Justin Trudeau has to say.
Bon vendredi tout le monde. We're headed into the first weekend of December, and in many parts of the country, the situation is very serious. Wednesday, Quebec reported a single-day record of new cases, and across the country, we're seeing numbers rise. The health minister spoke with her counterparts last night and assured them that the federal government will offer all support needed, especially in Alberta, where the numbers are rising alarmingly. Earlier this week, Minister Hajdu had a bilateral conversation with Alberta Health Minister Tyler Shandro. We will do whatever is necessary to help all provinces and territories deal with these outbreaks and get this situation under control. Across the country, cases are too high and hospitals are filling up. And when hospitals fill up, everyone suffers the consequences, not just those with COVID-19. We all know healthcare workers who are tired, who are stretched out, who are doing overtime. Canadians with surgeries are getting cancelled, and people can't visit their loved ones in hospitals when they do go into hospital. This is what's at stake. This is why we all need to do our part. Now is not the time to blame one another or point fingers. Now is the time for us to keep working together. Depuis le début de la pandémie, nous avons distribué des centaines de millions de pièces d'équipement de protection individuelle à travers le pays. Dans les derniers mois, nous avons aussi distribué plus de 6,7 millions de tests de dépistage rapide aux provinces et aux territoires. Nous les encourageons à les utiliser pour aider à protéger la population. Maintenant, parlons du vaccin. Mercredi, le Royaume-Uni a été le premier pays à autoriser le vaccin contre la COVID-19 de Pfizer-BioNTech. C'est une nouvelle très encourageante. Pendant qu'on continue d'échanger avec nos collègues à l'international, ici, l'examen indépendant de Santé Canada est toujours en cours. Je peux vous dire que les équipes travaillent très fort. C'est important qu'on s'assure que le vaccin soit efficace et sécuritaire pour les Canadiens et qu'il respecte nos standards. L'analyse d'un vaccin, ça représente des centaines de milliers de pages de données. Il y a des ressources supplémentaires qui ont été allouées et en attendant la réponse, on accélère le travail sur le terrain pour s'assurer d'être prêt avec un plan de distribution solide. Health Canada's independent review of the Pfizer-BioNTech vaccine is ongoing, and regulators are working around the clock. Let's also remember that Canada's deal with Pfizer is just one of many. We also have agreements with 6 other promising vaccine manufacturers, including Moderna and AstraZeneca Oxford. The National Operations Centre is working closely with the provinces and territories every day. The centre will be managing and tracking the distribution of vaccines once they are authorized. Yesterday, Major General Danny Fortin briefed the media and talked about how military expertise will be key to our vaccine rollout plan. For the first vaccines that could be authorized for use, or for what we call Track 1, specific logistics will be required to keep the doses at very, very cold temperatures. The Canadian Armed Forces is already holding simulation tests of this distribution plan with a series of exercises and run-throughs. Freezers have been purchased and dry ice contracts for cold shipping are being put in place. When vaccines get authorized and shipped, we'll be ready. Protecting you and your family and defeating COVID-19 is our top priority. Every Canadian deserves to be safe, and that includes the seniors who helped build this country. We've seen over the past many months far too many terrible tragedies in seniors' residences. We need to do better for our parents, for our grandparents, and for elders across the country. Through the Safe Restart Agreement, the federal government has already provided $740 million to help provinces and territories address the immediate needs of vulnerable populations like those in long-term care. And this week, Deputy Prime Minister Freeland presented the fall economic statement in which we are committing up to $1 billion for a safe long-term care fund. This fund will help provinces and territories carry out infection prevention, improve ventilation, and hire staff or top up existing employees' wages. We are ready to keep doing our part for our seniors and for all Canadians. Cette semaine, nous avons présenté notre énoncé économique dans lequel nous avons mis quelque chose bien au clair. Nous voulons aider les provinces et les territoires à protéger les aînés dans les établissements de soins de longue durée. Dans le cadre de l'accord sur la relance sécuritaire, le gouvernement fédéral a déjà investi 740 millions de dollars pour aider à répondre aux besoins immédiats des populations vulnérables, comme les personnes en soins de longue durée. En s'appuyant sur ce que nous avons appris suite au déploiement des Forces armées canadiennes ce printemps, nous allons investir jusqu'à 1 milliard de dollars dans le fonds pour des établissements de soins de longue durée sécuritaires. Ces fonds permettront de faire de la prévention d'infections, d'améliorer la ventilation, d'embaucher et de bonifier des salaires. Au sujet de la prévention, j'annonce aujourd'hui un investissement de 1,8 million de dollars qui permettra à 12 équipes de recherche de travailler en partenariat avec différents établissements de soins de longue durée afin d'étudier les mesures en place. Ces équipes pourront alors faire des recommandations qui aideront à mieux protéger les aînés maintenant et pour l'avenir. This morning, we learned that Canada's labour market gained another 62,000 jobs in November. This means 2.4 million Canadians have returned to work after they lost their jobs during the pandemic. We're making progress, but there's still much more work to be done. This is a tough time for everyone, and the small business owners at the heart of our communities are no exceptions. Those small business owners are our neighbors and our friends. They're incredibly hardworking, devoted people. They're there at the heart of our communities, there at the foundation of our economy. And this is a time where we need to be there for each other. We need to be there for everyone. Since the spring, the Canada Emergency Business Account has helped almost 800,000 small businesses right across the country. This program has made a real difference, and people still need this support. And that's why we are now expanding CEBA. Starting today, if they need it, eligible small businesses can access a second CEBA loan of up to $20,000 on top of the initial $40,000 that was already available to them. And again, $10,000 of this additional financing will be forgivable if repaid by the end of 2022. These measures will protect jobs, make sure the local businesses that we love don't have to close for good. I'm calling on everyone to do their part. In this holiday season, it is a moment for generosity. Everyone's trying to care for their loved ones. Try and make sure you're also supporting local businesses and ordering takeout from local restaurants. Your local business owners are adapting, are getting creative, are figuring out ways to continue to serve you. So we need to do our part as Canadians to lean on each other, to be there for each other, and to support everyone as we get through this pandemic. Pour aider les petites entreprises à traverser cette crise, nous mettons de l'avant une expansion du compte d'urgence pour les entreprises canadiennes. À partir d'aujourd'hui, les petites entreprises éligibles qui en ont besoin pourront avoir accès à un autre prêt allant jusqu'à 20 000 $ supplémentaires en plus du prêt de 40 000 $ déjà disponible. Encore une fois, de ce nouveau montant, on compte 10 000 $ de prêts à remboursement conditionnel. On a tous un rôle à jouer dans la lutte contre la COVID-19 et ses conséquences. Pendant que vous commencez votre magasinage des fêtes, pensez à aider les commerçants du quartier. On a tous des amis, des voisins, des membres de nos familles qui travaillent pour les commerces locaux. Le mois de décembre est un mois essentiel pour les entreprises à travers le pays. Et depuis des mois, ils s'adaptent à la situation, ils sont créatifs dans la façon qu'ils vont continuer de pouvoir livrer pour les Canadiens. Alors, continuons de les encourager. Il ne faut pas oublier les boutiques locales, les boutiques en ligne locales aussi. Et souvenez-vous que les fêtes, c'est un moment pour être généreux envers nos familles, envers nos proches, mais c'est aussi un moment pour penser aux autres, surtout à nos petites entreprises vulnérables, pour les aider à passer à travers cette pandémie. Il faut continuer nos efforts. Gardez vos distances, portez un masque, évitez les rassemblements et servez-vous de l'application Alerte COVID. À ce jour, plus de 5,6 millions de personnes l'ont téléchargée et dans les prochaines semaines, même si ça ne nous tente pas, il va falloir continuer à suivre les directives des autorités locales de santé publique. Il y a des vies en jeu et on ne peut pas se permettre de ralentir nos efforts. Before we end today, let me take a moment to talk about our introduction yesterday of Bill C-15, legislation to implement the United Nations Declaration on the Rights of Indigenous Peoples. On this, I want to recognize Minister Lametti, Minister Bennett and their teams, but more importantly, Indigenous leaders and partners who have worked tirelessly for decades in the efforts that led to this legislation. Bill C-15 mandates the federal government, in consultation and cooperation with Indigenous peoples, to take all measures to ensure that the laws of Canada are consistent with the Declaration. This is a momentous step forward on the path of reconciliation as we work together to build a better Canada for everyone. Our government is committed to seeing this bill reach the finish line within our mandate, and I call on all parliamentarians to help make this a reality. Merci beaucoup tout le monde.
Good morning, good afternoon, and good evening. This week, I was pleased to see that the United Kingdom's Medicines and Healthcare Products Regulatory Agency gave an emergency authorization for the Pfizer-BioNTech COVID-19 vaccine for rollout. Just like with the UK's finding on dexamethasone in the summer, this is an important scientific step for the world, as vaccines will be critical in the battle against COVID-19. Progress on vaccines gives us all a lift, and we can now start to see the light at the end of the tunnel. However, WHO is concerned that there is a growing perception that the pandemic is over. The truth is that at present, many places are witnessing very high transmission of the virus, which is putting enormous pressure on hospitals, intensive care units, and health workers. Some countries in Europe have managed to reduce transmission of the virus by putting stringent measures in place that limit people from mingling. As previously seen, as these measures are lifted, it's important that people should continue to follow national and local measures to ensure that cases do not rebound. Even as vaccines are rolled out, people will need to keep adhering to public health measures so that everyone is protected. We know it has been a hard year and people are tired. But in hospitals that are running at or over capacity, it's the hardest it can possibly be. My personal ask to people is simple. Please be careful. Think of health workers and act for the greater good, because it will save lives and livelihoods. Fighting this pandemic is everybody's business. The government and every citizen. The pandemic still has a long way to run, and decisions made by leaders and citizens in the coming days will determine both the course of the virus in the short term and when this pandemic will ultimately end. With vaccines now being introduced, it's really important that they are distributed equitably around the world. Since Gavi, CEPI, and WHO set up the COVAX facility in April of this year, 189 countries and economies have backed it. WHO is engaged with our partners at all levels, working to boost manufacturing and ensure rollout of COVID-19 vaccines. A new 100-100 initiative, a major sprint by WHO, UNICEF, World Bank, Global Fund, and Gavi, aims to help 100 countries conduct rapid readiness assessments and country-specific plans within 100 days for vaccines and other COVID-19 tools. First, we're asking all countries to do a country readiness assessment that takes into account cold chain, health worker capacity, micro-planning, initial target populations, and training. This will form the basis of national deployment and vaccination plans, which will outline how to roll out the COVID-19 vaccines and identify any potential bottlenecks that will need to be planned for. For decision makers, this means passing any legislation and policies needed to expedite the process, ensuring the regulatory process is fit for purpose and confirming that the financing is in place. The COVAX facility, which is the vaccine arm of the ACT Accelerator, intends to provide doses to enable the 189 countries and economies to vaccinate those at highest risk of the virus. In the first phase of the rollout, sufficient doses will be provided to cover health and social care workers. As supply increases, vaccines will be rolled out to cover 20% of the population of participating countries and economies, which will ensure further high-risk groups are covered. The payoff from this will be huge. New research by the Eurasia Group found that the economic benefits of a global, equitable vaccine solution alone for just 10 high-income countries would be at least $153 billion in 2021, rising to $466 billion by 2025. COVAX has already secured 700 million doses of 3 vaccines, and next year we aim to use additional funds to ensure that at least 2 billion doses of safe and effective vaccines are available around the world. To ensure that this effort becomes a reality, the ACT Accelerator urgently requires a cash injection of $4.3 billion to fast-track critical areas of work and ensure that rapid tests, treatments, and new vaccines are distributed equitably. On equitable distribution is the right choice and the smart choice. As well as ensuring supply, manufacturing, logistics, and funds are all in place, it's important to ensure that leaders communicate with their populations about the importance of vaccination and how and where to get it. The WHO Technical Advisory Group on Behavioral Insights and Sciences for Health, which was recently established and chaired by Professor Cass Sunstein, released a report this week focused on how best to ensure high coverage of new COVID-19 vaccines. The report provides initial lessons and recommendations. However, like with everything in this pandemic, we need to learn fast and be ready to quickly adapt our strategies.
Okay, that was Dr. Tedros discussing the global conditioning of the pandemic. And while we're hearing great news of how the vaccine has been fast-tracked, and you heard what was going on, especially in the UK, with the teams in Oxford with the vaccine and getting it approved and fast-tracked so people can have it and it can be distributed to the most vulnerable. And then to the rest of us, you heard the words of warning there that the pandemic still has a long way to go while they are trying to get everybody as possible vaccinated to cause a large-scale immunity to help in the pandemic. You've also heard in one of the past segments that, of course, the pandemic, the COVID-19, or this particular version of the coronavirus is going to be with us for a very, very long time, and that it may wind up being like the flu, that we may have to get annual vaccinations towards this. So the pandemic is going to be with us for a short time. Short time meaning it may be a year or two, but the coronavirus is going to be with us for a much longer time. So let's move on to the next segment. The next segment is with John Horgan, who is going to discuss measures that were taken in British Columbia. And you might find, if you're listening outside of British Columbia and outside of Canada, you may have realized that similar measures are being taken in other jurisdictions, governments, and countries. That we need to limit our physical contact, we need to wear a mask, we need to wash our hands, we need to listen to all these measures and other measures that are told to us by our local health authorities in order to help curb the spread of COVID-19. So let's get on with what Mr. Horgan has to say after he was just re-elected, and they have sworn in a new cabinet, and the British Columbia government is open for business. So let's just know what that has to say.
Good afternoon, everyone. It's good to be here on the traditional territory of the Lekwungen-speaking people, Songhees Nisquamish First Nation. I just want to say that we've just completed the first cabinet minister of the new cabinet meeting of the new government. It included old ministers, new ministers, a diverse group of British Columbians, all committed to serving, protecting essential services, making sure that we're helping businesses, individuals, and communities as we continue to struggle with COVID-19. At the outset, I want to say I want to pass on my condolences to the 457 families who have lost a loved one as a result of COVID-19, and to the many thousands of families who are struggling now with isolation, struggling with concerns and fears for their loved ones and their communities. Hope is on the way. Dr. Henry will be advising in more detail later on about the progress we're seeing in Canada and around the world when it comes to vaccines and the distribution of those vaccines. But at this point, we've got to continue to focus on keeping our hands clean, keeping our distances, making sure we're not gathering in large numbers, and of course, always wear a mask when you're indoors or in public spaces. The challenges ahead are significant. We know that. We've known that for many, many months. But as we get into December and look at the Christmas season and Hanukkah and other celebrations, we need to make sure that we keep those celebrations to an absolute minimum. There will be difficult times ahead for family gatherings. There will be difficult times ahead for how we conduct ourselves as individuals, as families, as communities. But if we continue to focus on protecting each other, we'll come through this stronger than ever before. Next week, we will recall the legislature to pass a couple of pieces of legislation, a small throne speech to highlight the events that we have ahead of us and how we plan to deal with those going into the new year, as well as passing supply for the $1,000 family benefit and the $500 benefit for individuals. There are a range of other issues. I know they're topical and on the minds of the media and on the public. I'm happy to answer those questions at this time, but again, I just want to reiterate how proud I am of the vast majority of British Columbians who recognize that we are in a significantly challenging time, and you're all stepping up. So thank you for that. Let's keep doing it.
Thank you for listening to Depictions Media, and this is Policy and Rights, and I am Michael. And please do adhere to what your local health authorities are telling you, and don't think just because, hey, there's a vaccine, it's going to be distributed, this is all going to be over. We still have to proceed very cautiously. We still have a long road to go before this pandemic is truly over. But we will get through it if we all do what the health authorities tell us, and we all just use a little common sense, wash our hands, wear a mask, and curb the violence is actually being seen out there. So, again, thank you for listening. Please do subscribe so you can get more continued updates from us. Bye for now. This show has been produced by Depictions Media. Please contact us at depictions.media for more information.